My name is Sydney. I'm a labor and delivery nurse, and I'm going to tell you how to reduce tearing in labor and delivery. A lot of you guys were wondering if there's a specific position that you can push in order to reduce tearing. And unfortunately, if you're going to tear, it's going to happen. I think there's more things you can do prior to delivery that might help reduce the chance of tearing, but it is very common for first-time moms to have what is called a first or a second degree tear. So tearing depends on a lot of different things. First of all, your genetics and your tissue type. Is it super stretchy? Is it not? How far is your, or how long is your perineum? That's another thing that can impact your tearing. But the number one thing I would say is perineal massage. If anyone's heard of it, there's a lot of good videos online. You can Google on how to specifically do a perineal massage, but basically you want to be massaging that perineal area, which is, let's say this is your vagina and this is your rectum or your anus, then you're massaging right underneath. This is your vagina here, and you're massaging here for about 5 minutes, and this just helps to kind of loosen that area up and hopefully stretch it out a little bit for delivery. What I will say is that the vagina and the tissue of the vagina heals very well and is very stretchy. So even if you do tear, it will heal really, really well. It just takes some time, but it will heal back to what it was pre-pregnancy or pre-delivery. Another thing that you can actually do during delivery is if the baby is okay, meaning the heart rate isn't dropping at that particular time, as long as the head can slowly come through the perineum and there can be, what we call controlled pushing, this allows time for that tissue to stretch and allows for, less of an abrupt pressure of the head coming down, which would cause an immediate tear in the vagina, basically. So if the baby's coming really, really, really quickly, then you're gonna tear usually more than if you can control your breathing and let that ring of fire burn for a little bit, because that is what helps to reduce the tearing at the end of the day. But in terms of positioning, I would say that any position you're in is good. Whatever is comfortable for you, that's all that matters. And really whatever you can control your pushing the best in. If you can slow it down and connect with your breathing, I think those are the best ways in order to prevent tearing. But really focus on that perineal massage prior to delivery. That's your best bet for reducing the amount of tearing that you're gonna have.